Anatomical kinesiology. So what is the clean and jerk? Simply put, the clean and jerk consists of two stages. The first stage, called the clean stage, is a lift where the barbell is picked up from the floor and placed on the shoulders in one motion. In the second stage, the athlete lifts the barbell into the overhead position. We move in three different planes. The transverse plane rotates on the long axis while dividing the body into superior and inferior halves. The frontal plane moves on the sagittal axis and divides the body between front and back halves, while the sagittal plane moves on the frontal axis while dividing the body into right and left halves. And knowing this will help better understand the movements of the following clean and jerk.
In the preparatory phase, we have abduction and depression of the shoulder girdle, internal rotation, horizontal abduction, extension in the shoulder, extension and pronation in the elbow, wrist flexion, finger flexion, pronation of the hand, flexion of the hip, flexion of the knee, dorsiflexion of the ankle, and extension of spine and trunk.
Major muscles involved in preparatory phase include pectoralis major and minor, trapezius, latissimus dorsi, teres minor, deltoid, pronator teres and quadratus, triceps brachii, flexors of the hand and wrist, rectus femoris, adductor brevis and longus, gluteus minimus, biceps femoris, semimembranosus and tendinosus. In the movement phase, we have elevation and upper rotation in the shoulder joint, flexion, abduction, internal rotation in the shoulder, extension and pronation in the elbow, wrist flexion, finger flexion, and pronation in the hand, hip flexion to extension, anterior pelvic rotation to neutral position, flexion to extension in the knee, dorsiflexion to plantar flexion in the foot. Muscles include trapezius, deltoid, pectoralis major, rhomboid, subscapularis, pronator teres and quadratus, triceps brachii, flexors of wrist and hand, rectus femoris, psoas major and minor, gracilis, semimembranosus and tendinosus, quadricep muscles, and soleus.
Follow-through phase includes downward rotation, abduction of shoulder girdle, abduction, extension, external rotation in shoulder, flexion and pronation of elbow, wrist extension, finger flexion, hip extension, anterior pelvic rotation, knee flexion, dorsiflexion of foot.
Major muscles include pectoralis minor, trapezius, supraspinatus, deltoid, biceps brachii, pronator teres and quadratus, brachialis, gluteus, biceps femoris, semimembranosus and tendinosus, popliteus, extensor digitorum.
In the preparatory phase, we have elevation, adduction of shoulder girdle, flexion, abduction of shoulder, flexion, pronation of elbow, extension of wrist, finger flexion, anterior pelvic rotation, knees locked, and dorsiflexion of foot.
Muscles include trapezius, rhomboids, levator scapula, pectoralis major, deltoid, supraspinatus, biceps brachii, brachioradialis, brachialis, pronator teres and quadratus, psoas major and minor, rectus femoris, gluteus, tensor fasciae lata, rectus femoris, and quadricep muscles. Movement phase includes elevation, upper rotation, abduction of shoulder girdle, flexion, internal rotation of shoulder, extension and pronation of elbow, wrist extension, finger flexion, extension and anterior pelvic rotation of hip, knee flexion to extension, dorsiflexion of ankle. Muscles include trapezius, levator scapula, rhomboid, pectoralis major, subscapularis, deltoid, brachioradialis, pronators, triceps brachii, extensor group of wrist, semitendinosus and membranosus, biceps femoris, rectus femoris, gluteus.
In the follow-through phase, we have elevation, upper rotation, abduction of shoulder girdle, flexion, internal rotation of shoulder, extension and pronation of elbow, wrist extension, finger flexion, extension and anterior pelvic rotation of hip, knee extension, and dorsiflexion.
Muscles include serratus anterior, trapezius, rhomboids, levator scapula, deltoid, pectoralis major, coracobrachialis, triceps brachii, anconeus, palmaris longus, psoas major and minor, rectus femoris, sartorius, extensor digitorum. What is a Q angle? It is a measurement of the angle between the quadriceps and patella tendon. It is measured from center of patella to tibial tuberosity and from patella to anterior iliac spine. Normal Q angle for males is 20 degrees or less, and for females is 20 degrees or less due to a wider pelvis. People with higher Q angles are more prone to knee injuries. Common joints include glenohumeral, radial ulnar, wrist, phalangeal, hip, knee, and ankle joint.